We'll now have Mayli. So Mayli Foong is the WA State Manager at the Pharmaceutical Society of Australia. Thank you, Mayli. Just click that. Okay.
Hi, so today I was going to talk to you about a bit of an overview of the farm's impact on vaccination coverage in Western Australia. So here we've got a friendly pharmacist with a member of the public. So today I was going to talk a little bit about our contribution to the vaccination rates, which vaccinations pharmacists can currently administer in community pharmacy, and and obviously this is about to change in January, and I feel like this is going to be quite a fast evolving space moving forward. What the funding options are, because again, that's something that's going to change as well. And also, what are our future opportunities, whether they're private vaccinations or travel vaccinations or anything that's not, if someone wants to get administered, but they're not specifically covered by the NIP. So I guess I could start off on a high note. So in WA, what we saw is that we sort of, by percentage, we led the way by administering 991 influenza vaccines this flu season, which was approximately 38.1, which is not approximate at all, percent of all influenza vaccines. And this was way above the national average, actually, which was around about 23.7%. And I think what that shows is that the free flu campaign that ran over the 2 months really helped to boost our vaccination rates in WA. And I think that it just shows as well that the option of accessibility to the community was really well received overall. And here you can sort of see the annual influenza vaccine, like for the black section, which is in general practice, the mid-grey is other providers. And then the yellow section is for pharmacy. And of course, you do have various healthcare providers working in different practice settings. So you might have nurses working in pharmacy, you'd have pharmacists working in GP, but this is overall just the site that they were administered. Of course, with COVID, pharmacists across Australia delivered about 11 million COVID-19 vaccinations Australia-wide. And I think really it just showed that, having those extended hours, having the accessibility, and, whilst a lot of pharmacists did run, COVID vaccination clinics, there also was the opportunity for people to walk in to have, the vaccinations at their convenience. And I guess it was better for the elderly patients, and pharmacists are trusted health professionals. What more can I say? So at the moment in community pharmacy, pharmacists can administer vaccines from, I guess for COVID, it's overall there's no age limit, because that was a target advice. But in general, it's influenza from 5 years, DTPA from 11, and MMR, meningococcal HPV. So at the moment, the options for when people want to go to community pharmacy for a vaccine aren't so broad. So the downside of that is, the converse side of that is that sometimes there is confusion, from the public over which vaccines can a pharmacist administer and which ones can't. And so sometimes they might not go at all, which is, I think it's good that it's something that's going to change from the beginning of January, so that they'll know that they can go to a doctor, you can go to Aboriginal health practitioner, you can go to the pharmacist. I don't think Aboriginal health practitioner, I think, is coming, but that type of thing. And I think that's really positive. This is sort of an Australia-wide snapshot of NIP vaccines across Australia, of what can be administered. So the green ones are the NIP. In Queensland, on the 1st of October, 30th of October, they recently announced that that Hep B, chickenpox, Men-B, HPV, herpes, JEV, and typhoid vaccines can be administered in a pharmacy from 2 years of age. Whereas I think, it does vary from state to state. And later on, I'm going to show you like sort of what the national data is on vaccination rates within Australia. And I think I know in Queensland, like they did reduce the age that to improve accessibility for vaccination within like various settings, including the pharmacy. And that was really to boost immunisation rates overall. And WA's immunisation rates look kind of similar. So I've just pulled this data from the national vaccination coverage, and I think we just heard that it's not 100% accurate, but it sort of gives us a rough indicator of where we're at. So in WA, like the 1-year-olds were doing pretty well. If we look across all of them, at about 93%, and then it sort of drops off a little bit. Well, it's sort of about the same, as we go through our 2 years and 5-year-old, but it is lower at the 2-year-old rate. But if we look at the immunisation coverage in WA compared to the other states, it is slightly lower. So I guess there would be a potential benefit to increasing accessibility to, say, from 2 years or to remove it altogether, so that there is the option when if the parents can't get into their GP and they're running late, or that they can have their immunisations done. So within the reimbursement that's coming, I think we all know that the health minister sort of announced that it will be funded for NIP vaccinations for administration in pharmacy. So it will be $18.85 is the administration rate that's going to be paid to pharmacists. We don't know yet, like, if, for influenza, what's really going to happen, but we know that for all of the, if it's going to be expanded or not, but we know that for general NIP vaccinations that you'll be able to go to the pharmacy and you'll be able to get it for no cost. If there are any private people want to be vaccinated outside of the NIP, then there will be a cost for the vaccine as well as the administration fee. But I think that's going to be really good, because that sort of opens the door as well for, especially in the regional areas and the remote areas, for Aboriginal health, and to improve those vaccination rates as well. And this is sort of a touch, like we run into some questions often in pharmacy where people say, can you administer travel vaccines or not? And we generally say no. But then they go, but what if I need this influenza, or I want this MMR, or I want this whatever it is, and I need it because I need to travel to a particular country, like, can you administer or not? And I think in WA we're quite lucky compared to other states in terms of the SASA that the pharmacists need to stick to states that you can do either private or NIP vaccines, as long as it's on that list. And we see that there's variation between states and territories where if it can be NIP, but if it's not NIP, you can't give it. So, if people are travelling from different states, or if healthcare workers are travelling interstate, or, working in different states, it can be slightly confusing. So, like, I guess it's an opportunity for future, if that helps to reduce future hospital admission costs and as well. So overall, I was just going to leave you with the list of what pharmacists can administer Australia-wide. And, so I think in Victoria, like, pharmacists can administer monkeypox and JEV. I think in WA, though, like, it really depended on what the environment was like here. And I don't know, it was a very active decision that we didn't really need pharmacists to administer JEV, because there wasn't that same outbreak that was happening in South Australia and Victoria at the time. And I think that's it.
Are there any questions for Mayli?
Thanks, Mayli. Can I just clarify? So from January, there will be no fee to the patient for NIP vaccines. Was that what you were saying?
Yeah, from the 1st of January, when the Commonwealth kicks in their funding.
Yeah.
But the Commonwealth will need to make that proper announcement.
Okay. So the pharmacist will get a fee for that, and then the vaccine's free.
Yeah.
Thanks.
But it might not be the 1st of January, depends when.
I just wanted to ask, will the pharmacies be available Saturday, Sunday from the 1st of January for those children, the younger children?
So depending when Minister Butler makes the formal announcement, that will be when it actually starts, because WA Health, they'll need to write the legislative instrument, which is the SASA for pharmacists, and that will be written to reflect whatever Minister Butler announces on the date. So I believe that they're working to have it ready to go, but the date might be not exactly then. And in terms of Saturday, Sundays, it is a requirement that pharmacists, you can't be a sole practitioner in the pharmacy at that one time. You would need to have an additional person to be able to assist with first aid or anaphylaxis and that type of thing. So it might vary between pharmacy to pharmacy, and yeah.
And will it still be an online booking system?
Some will have an online booking system. I know that a lot of pharmacies, they're probably best off ringing their pharmacy beforehand. And because I know that a lot of pharmacies just say, yes, we have this vaccine, or and you can pop in any time between, say, 9 and 5 or 9 and 6 or whatever, as long as they have the heads up. With some of the vaccines, they might have shorter shelf lives or whatever, as you know, or it might just be that you might normally have 10 in stock, but if 11 people happen to come in that day, then you're going to say, sorry, I don't have any right now.
Just me, Pali from the immunization program. I think it might be before you came into the room, there was a question around the cold chain management and advice for pharmacists for private stock, because we had a presentation on cold chain. So because we mainly work in the NIP space or government funded space, just wondered if you had any comment on that. For when a patient goes to a pharmacist, gets their vaccine and then has to carry that to the GP, that whole process of managing the cold chain. Yeah, so if they need to bring, and that type of process has been going on for many, many years. It's not anything that's new. So, the fact the patients are told that it is a refrigerated item, and, and it'll be put into a cold bag, but obviously the cold bag doesn't last. You can't stick it in the car and leave it there for a day. So, they are told to either take it preferably to go straight to the GP practice. I guess, having said that, not everyone lines up their appointments like that, and so if they can't, if they're picking up the night before to go to the GP the next morning for 7 o'clock in the morning, then they will be told to go home and put it in the fridge, not to leave it out. And I am aware that there's that there are various discussions in place where people say you need to go directly, you can't put it in the fridge at home. But I think in terms of stability of vaccinations, I can't say this if this is a very general statement, but many vaccines and medicines do have cold chain data, which would support some breaches in order to get it from the place of manufacture on a plane to sit on the tarmac to the pharmacy, into the fridge, and then into the person's arm. Thanks.
Thank you, Mayli.